To introduce myself first, I am Dr. Parul. I'm a consultant with Melap Group and an MD in biochemistry. So today we will be discussing the topic of personal records. As per ISO 15189-2022, this personal clause, initially it was in 2012, it was in 5.1. In clause 5, which says the technical requirements. The first number of technical requirements. Now it comes in the clause of resource requirement, the first clause of resource requirement, which is 6.1. So all the personal records related to any person who is working in the lab comes in 6.1. Now, what is the journal requirement for personnel? So, personal records, we start it in an opposite manner because first, because our topic of discussion was records, that what all records to be maintained under this clause. So, we will start from back. What are the records which are important or will be seen? Lab shall have a procedure. First of all, you should write wherever necessary for personal the procedure. We will discuss it where you need the procedures. Then we have to retain a record. Record of what? The competency of the persons, determining the competency requirements which are specified in clause 6.2.2a. So any activity of lab where you have to define where the competency will be assessed. So pertaining to that, how you are assessing the competency, you have to write a procedure and you have to maintain a record. That how we will maintain it in the form of record. Then position descriptions. Position descriptions record should be available. Like iska position description ho gaya. Today, like I am a senior phlebotomist or I am a junior consultant. मुझे ये right है कि मैं validation, verification कर सकता हूँ equipment की, report authorization कर सकता हूँ. Like me, there are 2-3 doctors or like 2-3 senior technical staff. So, who is on that position that month? उस महीने उसका वेरिफिकेशन हुआ नहीं इक्विपमेंट का इस मंथ, who is on that position, and next month some other doctor can be on that seat. So you can say a roster you have to design, which usually every lab has, and it should be written in the job descriptions कि what at what all positions you will be placed, कि आप क्या क्या कर सकते हैं और आपको क्या क्या पोजीशन दी जाएंगी एंड मंथली आप किस ड्यूटी पर हैं वो. सो आपको एक तरह से जॉब डिस्क्रिप्शन भी रखना है और आपको रोस्टर भी रखना है. देन ट्रेनिंग एंड रीट्रेनिंग्स. द रिकॉर्ड ऑफ ट्रेनिंग एंड रीट्रेनिंग इज रिक्वायर्ड. what training you have given, to whom you have retrained. So effectiveness of training you have to assess. Then authorization of personnel. Authorization of personnel is to which person which duties have been allotted or authorized to perform certain specific activities of the lab. Then monitoring competency of person, which is first. Next is the quality specific essential person. It is about obtaining and retaining an adequate number of qualified, well-trained, competent lab staff. So the first clause of personnel's journal says that you should know how much staff is required for this workload. So a adequate number of staff should be available. Then the same line says an adequate number of competent staff should be available. You have to define the competency. Like we say, हमारे पास कलेक्शन भी है, हमारे पास जो सेपरेट ग्राउंड फ्लोर पर है, लेकिन हमारी लैब फर्स्ट फ्लोर पर है. सो हमारी कलेक्शन के लिए विच टाइप ऑफ स्टाफ, क्या हम डीएमएलटी लेंगे, क्या हम अपनी लैब के लिए बीएससी एमएलटी लेंगे, क्या हम सीनियर क्वालिटी कंट्रोल्स के लिए MLT with 5 years training लेंगे. So in a way we have to define adequate number for the staff and the competent staff. Competency in the form of qualification, training, and how you will perform the competency in your lab related to any kind of lab activity. People are the most valuable resource of the organization. किसी भी organization का success is depend on the person who is working with it. Any organization, we say, ye, this government organization is good. We say this private organization is good. Why the turnover is less? Why the turnover is less? People are good there. The required trainings are given to the qualified person. The required salaries are given, and at the same time, that person is also returning back the same competent work to the organization. Next is, what is the major requirement? Where is the policy needs to be defined, and a process needs to be defined, and a procedure needs to be defined. So, job qualification, the policy is we will take a qualified person related to our field. हमारे field से related हम एक qualified person लेंगे. Now, there should be a process. Okay. Now, there should be a process to determine and document required related to job qualification. You should ask, you should have like you usually give an advertise that we need a BSc MLT with experience of 5 years, who is trained in flow cytometry, who is skilled in quality management system, and an experience of 10 years for this position. So the process is that for this particular job to qualify it, you need these, this is your process of taking a person. Then process to develop the job description, you should have a process. If we are taking such a person, what will be his or her job description will be. Then procedure, where you need a documented instructions is like creating and maintaining job descriptions that specify duties and responsibilities for all personnel, because in a lab always there is a junior technician, then there is a senior technician, then there will be a technical officer, then there will be a junior consultant, senior consultant, and head of the department. So the job description of every started from a ward boy to a head of the department. The duties and responsibilities should be defined in the form of job description. Whenever you face any interview for any organization, you they send you a job description. What will be your job descriptions for this post? So you have to define that. Verifying the eligibility, applicants' education and credentials. They are verified, like they ask you your certificate, whether you have done an internal auditor's course for 15189. Where is your certificate for it? So this is how you can write in your procedure that the training certificates will be maintained. Then orientation. Once a person has joined, the next requirement is orientation of a new person to the organization. So how you will orient? Something like in the schools, when we join the next class, school gives an orientation program to the for your kid. It will be a half day orientation program. We all go, we all sit, they tell us how we'll teach the student. Similarly, lab should also have a policy that we will orient the new person to the organization. Now, what will be the process of orientation? We should know. If we have separate sections, then we will do right that we will send to the collection center, then we will send to the sample receiving, then we will send it to the auto analyzer orientation, then at the post analytical phase. This is the process. Now you have to write the procedure. In the procedure, you will detail mention. It will be a 14 days for the technicals. Let's say, I'm just giving you an example. For a technical staff, let's say it will be a 14 days or 21 days orientation. Let's say for the consultant, it will be a 7 days program. Whatever lab defines, the according to the according to the job and the qualification, you can define what should be the orientation period or induction period for the person who is joining your lab. So you will write that in detail, that how we will orient that person. On the sample receiving staff will tell him how to receive the samples, from where all we will receive the samples, what will be the sample rejection criteria as per our quality policy. So, and after that, the person on the third day will go to the sample processing unit. So, at the end, you will evaluate your orientation, your induction program for the technical staff, that yes, you can take a verbal like you can ask that person, or it's up to you that how you define in your procedure that you will take a written exam for that person, which is to know how much he understood your lab working environment. Then management of personal training. We will give a personal training, we will manage it. So processes and programs for trainings will be defined. There should be a training calendar. There will be a training plan for each staff. Each staff is like you have an internal training plan, you can have an along with that an external training plan. In your internal training plan, if you have two faculties, they can take one lecture in a month, but before that they will do a pre-training evaluation, how much you need training, on what things you need training for this particular topic. And after you have imparted the training, you will take a post-training evaluation, कि how much you understood from this training, whether this training which I have given you has actually improved your thought process of this particular thing or not. So pre-training evaluation you will take, it can be in the form of questionnaire, it can be in the form of verbal process, but it should be recorded. Then post training, only after post training you can check the effectiveness of your training program. Out of 10, maybe 8 persons understood the thing, but 2 persons they require to be retrained on that particular topic or some important key aspects of that particular topic. So effectiveness of that training program, that is also you have to mention in your procedure. Then assessment of competence. Competence is a process which is you start, and it should be ongoing. And wherever you feel the competence is not up to the mark, you should retrain or reassess the by helping the training of that person. So a process and program for competence assessment should be available. Initial competency, then ongoing competency. Initially you have assessed, you have a, you know, this I need this qualification for this post, and I want this much of experience. I want who is trained on this particular instrument previously. So this is what is the initial process. Your own ongoing is like you have a let's say you have a staining procedure, right? You can do a competency evaluation of your two technical staff for one for the staining procedure, and you can record it. Who has done a better staining, or who has done overstain the slide, or where you need or staining preparation, you can assess both of them. So where the training is required, then you can also do assess these competencies by direct observation of the person. Like it is given in the checklist, who has a better problem solving skills, you can directly observe it, who is better, who is maintaining the equipment when this person is on duty. Usually machines are for this month, their breakdowns are less, but who on this month, if someone is on IQC duty and there is less failures, you can directly observe and find out who is better in which. Then by creating the written assessments also, you can check the assess the competency. This is what you all need to mention in your procedure. You have a process that we have a competency assessment initially through job description, then ongoing assessments through these procedures like direct observation. When you write a procedure, and if you maintain a record of, you want to maintain record of that, there only you will say that this competency which is assessed by written assessment will be recorded and maintained in the form of this format. So you can there only write the format of this activity will be maintained, or record of this will be maintained. Creating record review assessments, who is better in record reviewing, establishing rating scales and scores of assessment tools. You can make a matrix of your how you will score them. Then the standard says that in personal management, along with competency, training, job descriptions, in orientation, a continuing education and professional development should be there. The continuing education and professional development is for specifically those who are either in managerial role or those who are in the technical processes, involved in technical processes. But this process should be for everyone in the lab, and the suitability of that process and the activities should be periodically reviewed. You should review it also. Like you should have a process for professional development. Like you allow your staff to go for some kind of uh, trainings. Let's say if there is a training on the IQC program, which is done either by Bioret, either by Recast, or your you are inviting them to take a class on this, or any other commercial or professional body who is uh, giving a continuous education, and the training certificates of those you will be maintained and you will periodically review. You can ask them, you have attended this Biored meet and what all you have learned. Next day you will come and you will tell the staff that what all you have learned during that continuing education. Same is like you as a consultant, you are going for 1 month's training somewhere in some organization for learning some new technique. Then usually the your organization asks, just submit a report what all you have learned over there. So this is how they are reviewed. They are periodically reviewed. You are contribute your knowledge and your continuing education, if it is as a role, if it is giving some benefit to the organization, they review it periodically and they allow the more trainings to you. Then performance evaluation, there should be a process for performance evaluation, that how you will evaluate and develop a criteria, performance criteria and the expectations. Completing performance evaluation form. These can be in the form of when there is a appraisal time. Usually you have seen that they fill up a key result, they discuss it with you. These were should be your performances. You have performed in well in 8 activities, but you need to work more on your ninth activity. So different kind of activities are written over there. So this is how the organizations they evaluate your performance. Then if you are leaving the organization there, or if you are someone has left the organization, even there should be a process for that in the organization, that returning all facility owned properties allocated to transferred or terminated person, and at the same time that the confidentiality of the organization where you have worked will be maintained. Then personal files, process for personal file, organization and maintenance. That should be a process. And you have to create a personal file and maintain those files. Like if you have taken any training, which is important, it should, there a copy of that should be recorded in the personal file. Usually, human resource department maintains the personal files. Then job qualification is lab management need to determine the process, necessary education, determine the necessary education, training skills, experience where applicable, certification, licensure for each job title. Staff members who make professional judgments related to diagnostic examinations or interpretations need the applicable theoretical and practical background as well as experience. This is how we define the job qualification, that yes, you have qualified for this job or this position. These qualifications need recording in a document in the form of job descriptions, in the form of your certificates, in the form of your DMC certificates, etc. It is just an example that is kept current. Qualification that are required at the national, regional, or state professional level or organization level need consideration when developing such documents. It should be as per the stated guidelines also. Then there are different topics. Orientation, For all these, now I will be showing you the formats, how you can maintain it. This is our formats we have designed just for teaching purpose, but you can certainly make changes in those. Orientation, that is induction program, management of personal training, assessment of competency, continuing education and professional development, performance evaluation, end of employment, personal files. This is the format. First is the induction program. Induction program is what will be the work ethics, lunch break will be given, everything is should be there. Employee department induction training, welcome to the department, introduction to the department functions we will explain. This will be explained by department in charge. QMS and NABL awareness will be given. Your key duties and responsibilities will be told to you by the department. Training on the department equipments and procedures. Then training on computers and softwares and LIS which you will use. Standard of the work which is expected. Confidentiality issues. Handling complaints. During the induction program, we will discuss all these with the new staff who will join us at any role in the lab. Then training on the quality assurance, all the standard operating procedures, guidelines should be covered during the induction program. Then here the activity covered, who on which date, how many days this activity will take. You have to write a date over it, who has taken the department in charge, and employee should sign it. Yes, these all have been told to me and informed to me. Then if it is in which section, biochemistry, HEMAT, then employee joinee form should be there, the name of the person. You know, you can keep it the record. If your HR is maintaining these documents, it's okay. But if department has to maintain, it's a small lab and department has to maintain, then they can just keep the details of this, the person who is joining. The next format is employee health record. You have to record, most important in this is your vaccination record for hepatitis, which we have mentioned over here, that you can get an titer done for this, and you can whether the person is vaccinated, what is the if he remembers the date of vaccination, or you can maintain the record of the titer and keep it in a file, or you can just fill in if first dose is given, second dose is given, or third dose is given. So even anti-HBs titer will work for these. Then next format is employee personal records. So how to contact that person, what is the telephone number, designation, when he has joined our department, what is the relevant experience, and then it should be signed by the person that whatever information has been furnished over here is best of my knowledge and belief. Then next is employee training record. So this is the training record. You can maintain it for one person, that individual for person, or you can maintain one training record for all the staff in the form of a attendance sheet. So you have to mention here date and the topic of training, that you have trained the staff for these many topics, and what was the duration, and whether he needs more training on this or not. So this is a employee training. Next is the competency assessment form. This competency assessment form is, there are many, you can see lot of points are written over here. So competency assessment, like equipment operation and maintenance. This technical competency will be assessed. You can do it by direct observation and you can rate the person. This you have to fill for individual person. Like for one technical staff, it could be 4, for another it could be 3, for someone it can be 5. Next activity is test and equipment calibration, which is a technical competency, equipment decontamination, equipment IQ, PQ activity, like who has performed verification well, who has coordinated well with the staff, who has maintained the raw data well, who has maintained the samples well. So you can directly observe and choose a person accordingly, that how you want to rate each and every person. So there are n number of activities in the lab for which the competency will be assessed for the staff. Order of sample draw is the person knows that patient preparation, whether he is asking what is, if you are taking, let's suppose, a drug, you are collecting a sample for drug estimation. So you should ask the patient at what time you have taken your last dose, whether it is a trough sample or it is a peak sample. So all these things you have trained, but who is working according, who is the best working person for that particular activity. So you can assess the competency, and wherever you feel training is required for this person, from this sheet you can find out, like you can say who is scoring 2 or less than 2 will be trained for that particular activity again. Then this is one employee suggestion form. So employees can also give suggestions, like there should be a staff meeting at least once in a month. We can do a staff meeting, or once in 2 months. Frequency can be decided where all employees should participate. And if we are starting a new test, let's suppose we are starting a rare test of drugs in our department, and employee or any staff can give us the suggestions. Initially, we should do it twice a week, because otherwise there will be a lot of consumption of the controls. Or someone can suggest we should do a rotation duty in this manner. So any kind of suggestions, if given by the staff, can be recorded either in the form of register. You can record it, or you can record it in the form of this suggestion form. It's up to you how you want to record it. This format has been designed just to teach you that how we should record the suggestions and the meetings done with the staff, what the benefits to the lab, what is the that we are uh, discussing is the work done in our lab. So recording is important of the personal suggestions. Then this is the attendance sheet. You have a training record. You can design a format where you can say that training on topics. Topics will be this training conducted by this faculty once in a month in in the month of January. Then on which day the training was conducted, that faculty will sign. Now that faculty has taken the training, he will get a training attendance sheet signed by who all have attended. Those who are in the night, they may not have attended this training. You might need to give the same training next month to those who are in the night duty. So you can record their attendance in this sheet, but writing a different date. So this is the attendance sheet, that how many employees have attended the training given to them.